welcome all of you to this week's media availability. First off, I'd like to start from the Senate perspective. We're off and running. We've had Ways and Means working the way Ways and Means is supposed to work. We've reviewed the governor's budget. We've gone through information last night on McCleary. I think it was something that members from both sides better understood the target dates and the amounts in a very readable form. We had a lot of good questions and input from members from both sides about what that might look like. We're going to look at the governor's revenue package today. So we're often functioning the way we are for the big job of the session, passing the budget. The other thing is the Government and Accountability and Reform Committee. We believe that if the public is to trust us and trust us to do big things, we need to be accountable, and they're serious about reforms. They're jumping in and they're taking a real hard look at lean management, and not just talking about lean management, but how do we better apply it to get a better value for the taxpayer dollars that are involved. So I think those are a couple of areas that clearly we're often running in, and I'd turn it over to Leader Christensen to talk about activities in the House.
And just like to preface my comments by saying I actually have to leave in about 10 minutes. So we're going to leave you with the first string here as I step out. But I just want to make sure that you understand that from a House perspective, we are already working with the Senate Democrats, we're working with the Senate Republicans, we're working with the House Democrats when it comes to budget already. We started on the first day. We've had, in many cases, numerous meetings per day related to what we're going to be looking at and what the challenges are going to be as we move forward. Early on, opening day of session, I commented on the fact that if we're going to meet that 105-day deadline, everybody else has deadlines. I think you guys might even have some deadlines today for the people you work for. We have deadlines, and we need to meet those deadlines. And so to do that, we need to hunker down and get the wheels spinning right away, and we're well on our way to doing that. And so I'm encouraged with what I'm hearing back. I'm encouraged that we've got all four corners of the building working together with respect to budgetary decisions. Yes, there's going to be some challenges, but what I'm also hearing back from a lot of folks out there is that, you know, let's be looking at that $3 billion. Yesterday was Education Day down here, and most of them, it was kind of interesting. We're bringing up the fact that, you know, we've got $3 billion in new revenue down here. We've got about a 9% increase in revenue to the state of Washington compared to pre-2008, where we were seeing an average of about 6% increase in revenue. It's a 50% increase. And I think the public needs to be keenly aware of what the realities are of the new revenue coming in as far as a percentage goes for us when we're making our spending decisions. We've got a lot of challenges ahead of us, and I'm looking forward to your questions. We've got some more comments, I think, from my fellow colleagues here. Thank you.
John?
I would just start off, build on what Dan had to say. First with the budget, I mean, you know, $3 billion more than last year, 8% increase. We have, you know, we have tough problems ahead of us, but we're not without solutions. That's a lot of new revenue, and I think that we should be talking about how we wisely spend that money before we have any discussion about taxes. A couple ideas that are bills that are out there I'd like to highlight. One has to do with taxes. Before we start that discussion at all, we should be talking about the tax appeals process, really the relationship between the taxpayer and the tax collector, and is it fair? Right now, the Council on State Taxation gives Washington a C in the way we handle our appeals process. We're well behind the rest of the country in the way we handle tax appeals. And before we talk about new revenue, let's get that right. Let's get the relationship right. And there's a good bill out there that creates a new tax appeals portion of the appellate court that gets after this problem in a real and meaningful way. The other thing I would mention is the bill out there that's been out for a couple years now to move the revenue forecast up a month so that we can get that information in time to get the budget out and finish on time. This is a simple bill passed out of the Senate last year, 49-0. It just gives us the tool to react on time and do the people's business in the time that we're given. And I think that's those are two really good steps to get us off on the right foot and get a budget out of here that's responsible and sustainable.
Well, I'm floor leader, so I'm looking forward to floor action. And I think it is a different situation now than it's been in the past. We've got almost a tied House. I think there's a sense that most bills that come out of the House are going to have to be bipartisan. I think the other side has been very realistic in recognizing that. And I think House Republicans are Also understanding that our job is to be part of the process of governing and being able to say yes when we're doing policy that appeals to the middle and also appeals to people clear across the state.
I'm Shelley Short. I'm the new caucus chair for the Republican caucus. I also serve as assistant ranking on the Environment Committee, and I sit on healthcare. But obviously, the governor's cap and trade bill will be shortly heard next week in our House Environment Committee. So we look forward to learning more about the bill. I have some concerns, but we'll look forward to the testimony too.
And I'm Linda Parlett. I'm the caucus chair for the Majority Coalition, and we'll be paying a lot of attention to the mental health issues. Along with Representative Jim Moeller, I co-chaired the Mental Health Task Force. It's called the Behavioral Health Task Force. It's a 2-year task force, so we'll take a break during session. But I would say that all of these issues dealing with chemical dependency, mental health issues, are not partisan issues. And we're going to have a few work sessions with the Healthcare Committee in the Senate and the Human Services Committee, because most of those issues on mental health go through the Human Services Committee, and we're all interested. So you will see a few more work sessions. And we haven't had the in-depth discussion yet in the Senate Ways and Means Committee, but we will. And again, this is an area where we can all work together. And I've experienced the tie when I was in the House in 1998 and or 1999 and 2000. And when you're in a tie or when the numbers are close, as Representative Wilcox says, it forces you in a positive way, in my opinion, to work together.
Okay, questions? Derek?
I'd like to hear each of you tell me what your feeling is on the issue of open carrying guns in the gallery of each of your respective chambers. We haven't had an individual answer from all of you, and I'd just like to hear each one of you put in your own words what your thoughts are on the issue.
Well, I'll lead off with mine. The Lieutenant Governor has interpreted the rules that that's a form of demonstrations and protests that have been prohibited in the Senate gallery. And Lieutenant Governor intends to ask security to enforce that rule against protests and demonstrations in the gallery, including that act.
I think from the House perspective, it's unfortunate that you had a few people that I think took advantage of a policy that has been, I don't think has needed to be clarified in the past. I would say that even if when you talk to the pro-gun community on the issue, they're pretty upset at the fact that some people took advantage of something that's worked since the founding of our state. There's really been no evidence since 1889 that there's been a problem with this issue. A few people can spoil it for the rest. It's unfortunate that we're having to make these clarifications, and I hope that we're able to settle this soon and that we don't have any other demonstrations like we had the other day.
Did the Lieutenant Governor make the right call?
I think it's hard to say that it isn't a demonstration or protest. I mean, clearly they were demonstrating against an initiative, and the Lieutenant Governor does enforce the decorum and protocol of the Senate.
Has there been a rules committee membership appointed? I saw in your announcement about Disability that there was going to be a rules committee right after, but does the Senate have a rules committee at this point yet?
We haven't finalized that yet.
Do you have a timetable at all?
Not exactly.
Isn't the rules committee usually finalized on the first day?
Well, normally it is, but we had one change made from floor action that day, and we're discussing how we move forward.
Transportation package, new session, are you going to be reviving the package you had last year? Are you going to go with a new one? And I'm coming at you with the fact that you now have only 12 guaranteed votes for your last year's package.
Well, I'm not sure about how many guaranteed votes we have.
You had 13 last year.
But the good thing
And one
is, we have 4 caucuses talking, and perhaps the governor's office. If you ever do a transportation package, you have to have communications with the 5 corners, and that's really important. It's always that way. You will never get 100% vote out of any caucus. It takes votes from both sides, and it begins with a broader discussion. And I'm sure behind the scenes, and I'm not part of that, those discussions are going on.
When do you think you'll have a Republican transportation package out?
I think we'll have a bipartisan package, and I'm not going to put an artificial due date on it. I believe that Senator Hobbs is working in good faith with Senator King, and it'll be a bipartisan package.
Senator Schessler, Senator Patton introduced legislation that deals with parental notification of abortion again. Would it be your intention, if that passes out of his committee, to bring that to the floor for a vote in the Senate?
We haven't had a discussion on the issue this year.
Follow up on her question. One of the basic premises of the Majority Coalition Caucus is you basically addressed the economic and education issues and didn't touch, I'll call them social issues for lack of a better term. Is that ground rule still in effect?
We still have our priorities. They haven't changed. The needs of the state haven't changed.
How about the House bill banning video and filming at farms? Will that get a floor vote if it gets out of committee?
Is that coming through the Ag
That
Committee?
would come through the.
No, it's coming through public safety.
Is it
Oh, it
coming
is
through
public safety?
Yeah,
Oh.
I mean, we're gonna have to see how a bill, progresses even out of committee before we can make a caucus decision on that. Until you've vetted these bills, that's what the committee purpose is for. Let's get the public input on it, let's have the dialogue, the initial debate. That's when we decide, especially the majority party decides whether there's a vote to even get the thing out of committee. And then, as far as the caucus perspective on it, we'll all learn about the bill and what actually may have or not passed through the committee before we make a caucus decision on it.
Following up on that, Representative Wilcox, you're a co-sponsor of that bill. You and Representative Schmidt, the author, you all are both farmers. Is that a conflict of interest in any way that would seem to help the business interest?
Well, I'm not a co-sponsor. If you look at the bill, I got off of it. I had somebody call me up, make the point. It seemed to me that they were right. So I removed my name from the sponsorship list.
Do you intend to vote for the bill?
I don't think it's going to see a place where I get to vote for it.
Why is that?
It seemed to me that the reception was not strong, was not favorable in committee, but we'll see.
There are a few bills that look at to kind of address enforcement of marijuana use on the road. I was wondering if you guys sort of have a sense that our knowledge of how marijuana impairs you is really enough to kind of pass those bills, including one that deals with banning open containers of pot in vehicles. Do we have enough knowledge of marijuana impairment and how that works to get those bills through, and is that something that should be done this year?
Well, I don't sit on the Transportation Committee. I would assume those bills would go there if they're related to driving on the road. But I think there's data out there, and if I were on that committee, I definitely would ask for that. If you recall, I'm a registered pharmacist, so I have great difficulty dealing with this marijuana issue because the federal government has not, and the mixed messages from the federal government are difficult for me. Marijuana is still a Schedule I drug, right there with heroin, LSD. So the initiative is passed, we have to deal with it, there's scientific evidence, and a smart committee chair would obviously bring that forward.
I think the argument related to this it also came out prior to the initiative passing. We've had for years there have been pieces of marijuana legislation that have been before the legislature, and I remember listening to members of our public safety, first responders out there talking about the fact that when we're talking about alcohol, you got a breathalyzer or a blood test that can be done, but the breathalyzer has been the real quick test to find out how impaired somebody really is. The problem they were having was a cost-effective, quick way of testing. While you may have the chemical from marijuana in your system for up to a month, what is the impact of that chemical? And that was one of the reasons why, actually over several years, the bill would never pass out of the House or the Senate. And we often even saw people who were the prime sponsors of these pieces of legislation, once they were educated on some of the challenges, bills were not able to even pass, and sponsors were not even able to vote for their own bills because they realized that there were too many unsettled questions. Science was not there yet at that point to be able to study and give us a conclusive answer that would let us know how impaired a driver is if they were on that particular, on marijuana in this case.
Is that science there now, do you think?
I don't know that it's there in an affordable fashion at this point. We're going to have to wait to listen to the scientists and find out if it's one thing to have it available. Is it affordable? And is it something to, like a breathalyzer that we can have every officer have in their squad car, or is it an affordable, device that somebody can put in their squad car to take an immediate test out there. My understanding is that the blood test was the most accurate, but it also, the chemical would be evident in your system for about a month. The other thing too is we're dealing with some conflicts as well between federal and state. You know, the federal government, especially, you know, Department of Defense, we've got one of the largest presence of military in the country right here. And they've got a zero tolerance on the chemical being in your system if you're an active military personnel. And, you know, so what's the device going to do with respect to those types of scenarios too? The chemical, you know, marijuana is used, as I understand, in many PTSD, post-traumatic stress disorder cases. But I've also been told that they actually, what they'll do is they'll take somebody who is active and they'll make them inactive to go through the treatment. Then they will reactivate them after they've been treated. I've been hearing some mixed issues on that as well. And so when you've got a zero tolerance from the Department of Defense on this, does it make sense how we're doing this in the first place? And again, going back to years prior to where we're at right now, many of these debates came up, and that's why in many cases a lot of the bills passed before it ever became an initiative. And now we're having to deal with the reality of it, and it's a struggle.
Senator Bartlett, with your knowledge of pharmacy and pharmacology, what do you think should be done in blending medical marijuana with recreational marijuana with two separate laws in the state?
Well, I do think we need to combine them. Many people say, and it's hearsay to me, that there's an underground market, and it would be best to put the medical marijuana together with recreational so we'll have a better oversight. And I look forward to hearing those bills. We haven't had them yet, but they're coming up in the Healthcare Committee. We've had this discussion for a couple of years, and I hope this year we can accomplish something. Again, I think there'll be bipartisan support in trying to solve this issue.
Senator Schessler, some members of your caucus have sponsored bills to extend the sales tax exemption for electric vehicles. And I'd be interested to know if that has leadership support and what you think of those bills as it currently stands.
Well, I think right now we have to pause and wait on all of the tax exemptions to see, are they going to create more jobs or not? And can we fit it in the budget box? So we've got to look at every one of the tax exemptions based on the budget box and how many jobs does it retain or create.
Senator Parla, I was talking to some frontline mental health workers yesterday, and they said that staffing is so short that to make mental health reform effective, that you need to have a staffing increase commensurate money-wise with whatever comes in to infrastructure, more beds and stuff. Is that the way you're seeing it?
Right. Staffing is a real issue, especially in rural areas. We had a bigger discussion today on the lack of psychiatrists. In rural areas, there's a real need for telemedicine, just so you can use that expertise in rural areas too. I think the telemedicine bill will be something to watch. It definitely will help us in the mental health arena. But staffing, healthcare shortages, it's a real issue. Not only in the mental health arena, but because of the Affordable Care Act. As you know, we have more people on Medicaid and so forth, so enrollments have increased. So access to care is important, and looking at our healthcare worker shortage is part of that discussion.
There's going to be fair minimum wage and sick leave bills. I assume Republicans will mainly be skeptical of those, but are there any of you who feel like you can support either or both of those?
I think we have that we're going to probably for now take a wait and see what the House does. I think there's two issues here. One, there's a clear philosophical divide on whether a minimum wage is truly the way to help poverty in our state. We have clear evidence. We have the highest minimum wage in the country, and yet our poverty rates have gone up. So we have clear evidence that this doesn't necessarily work from a philosophical perspective. At the same time, you have a practical perspective. We've had the passage in CTAC and in Seattle with threats of future initiatives. So we have to think about, okay, if there's going to be initiatives, should we get ahead of the process and try to solve this in a way that doesn't inadvertently harm the poorest members of our state. So I think you're going to see still a big philosophical divide, but a practical interest in if there is support in the House, how do we do this in a way that makes sense for a state and doesn't actually harm the poorest members of our communities.
I think on the House side, we're going to engage in the debate, but we have a different set of facts from the other party for the most part. That party, based on recent elections, has become pretty isolated in the Seattle area, where you have a world-class hotspot. We saw some testimony in front of appropriations in connection with the revenue forecast. It talked about the 13 metropolitan areas in the state. It's hard to believe that there's 13. But you had Seattle with unemployment of about 4%, and this is not to beat up on Seattle. Good for them. They are helping the rest of us. And then you see the rest of them, a huge jump. The closest is maybe 2 or 3% higher than that, and then most of the rest, in the 6, 7, 8, 9% unemployment range. So if you represent those people, you see a totally different problem. The most poverty-stricken parts of the state right now, actually they're not Republican parts, they're out in Grays Harbor County. But very many of the rural and Republican areas are struggling with 7, 8% unemployment and underemployment way beyond that. And so that's not really the solution to underemployment. And so what we're looking for is things that are going to work in Seattle, because we want to preserve that hot spot, but also for places like Yelm and Wakanda and all the other small towns across the state, and the small cities too.
So does preserving that hotspot mean that you allow the Seattle's policies on sick leave and minimum wage to stand?
That isn't really in front of us right now. If it is, we'll talk about it. But I'm just asking, again, going back to Joel Kretz, 3 or 4 or 5 months ago, was it that? No, it was more than a year ago. We've done the things that were necessary for Central Puget Sound. Now we want to work on the rest of the state.
I'd like to add to that a little bit, Jordan. We have border counties, and somebody needs to just once ask small businesses across the state their opinion on this. And then in the border counties, when you're in Clarkston or Pullman, and across the river, Idaho uses that federal rate. When you're looking at Spokane County, Pend Oreille County, your competition isn't in Bellevue, it's not in Renton, it's in a state that has the federal minimum wage. And they have a real tough time competing in those areas. If we go to an exceptionally high minimum wage, our friends in Clark County, Klickitat County that compete with Oregon, they have some issues too. So we got to look at the whole state, and for once ask the small businesses of this state, can they do it? Can they live with it?
Is there a danger of a two-tiered minimum wage system, 15 in Seattle and 67 currently now?
Highest in the nation.
Highest in the nation. If I was a 21-year-old in Whitman County, I'd book to Seattle just because working McDonald's there is, I make more money than the McDonald's in Whitman County.
John, we've already got a two-tier economy, right? I like the question because that's the economy that we already have, and that's why I think it's so important that we don't leave everybody else behind. They're just as important, and the kids that grow up in Yelm should have the same opportunity. Yelm is never going to be a world-class hotspot, right? We know that, and it maybe would ruin Yelm, but they should have the same shot. And that's about opportunity, not just putting a floor underneath it. And you'd be surprised. I had a waitress at a place I've been going to since the 80s come up and talk about the minimum wage, and she was not in favor of raising it. She says, I make good tips here. The folks here pay me what they can afford to. And she's talking about the patrons too. And she wasn't looking to have that disrupted. So yeah, it's a danger. And the problem is not two-tier wages right now. It's a two-tier economy.
I got it for 2 more questions.
There's also, wages may be higher in Seattle, rents are through the roof. There's some people who want, additional notice, things like that for renters of rent increases. I can't remember all the other proposals that housing, folks putting out there. But is that something that you would consider on that?
Well,
end,
I think that,
allowing either more local flexibility for a place like Seattle that wants that, or applying something state?
The key to holding down costs is increasing supply. And I think it's probably a disincentive to invest in more rental properties, more homes, if you put disincentives out there for the investors that want to create affordable housing.
Just to follow up on Jim's question, one of those other bills was to ban discrimination against Section 8 renters or other people who are paying for their rent with government benefits, veterans, disability, things like that. Do you think you could support something like that?
You know, I don't serve on those committees right now, so.
Or anyone up there,
Yeah,
really, for any of you.
One last question on drone. What if anything are you guys doing in your caucuses to try again on drone regulations or regulate government agency use of drones following the governor's veto of the legislation last year?
Is there legislation?
Well,
I haven't.
yeah, that's, at this point, it's been championed by the House, and I think we are concerned, had a conversation with some of the original proponents. I think it's very legitimate for people to be worried about surveillance in their backyard, you know, or in their pool, or, you know, wherever. This is not just a business thing or a farmer thing. This is a privacy issue for everybody. And I don't think that our caucus is happy with the governor's point of view yet, but we're going to engage and stand up for what's right on this one.
Thank you.
Okay.